Hi, good morning Jordan. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 25th of January 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Jordan Shell.
Alright Jordan, could you please confirm your candidate number?
Yes. My candidate number is 432334238.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Tell me about a time when you had to handle a difficult patient.
In a previous role, I encountered a challenging patient who was anxious and uncooperative. I first took the time to listen to their concerns, empathizing with their fears. I then explained the treatment plan in simple terms, ensuring they understood. I involved their family for support and collaborated with the healthcare team to provide the best care possible. This approach helped build trust, and the patient's cooperation improved.
How would you prioritize and coordinate a complex patient?
I would start by assessing the patient's overall condition and identifying any urgent issues. I would then communicate with all specialists involved to create a cohesive care plan. Prioritization would depend on the severity and urgency of each condition. Effective communication, collaboration, and regular reassessment would be key to ensuring the patient receives the best care.
How do you ensure that you provide patient-centered care?
Patient-centered care is essential. I always take the time to get to know my patients, asking about their preferences, cultural backgrounds, and individual needs. I respect their choices and involve them in their care decisions. By doing so, I can tailor the care plan to their preferences and ensure they are comfortable with their treatment.
Can you provide an example of a time when you had to work as part of a healthcare team to achieve a common goal?
Certainly. In my previous position, we had a complex case that required collaboration among nurses, doctors, and support staff. I actively contributed to team meetings, shared insights, and offered assistance when needed. By working together and utilizing each team member's strengths, we successfully managed the patient's condition and achieved our shared goal of delivering quality care.
How do you handle conflicts with colleagues or superiors in a professional setting?
Conflict resolution is crucial in healthcare. When conflicts arise, I strive to address them calmly and professionally. I prefer open communication, so I would approach the person involved and listen to their perspective. I express my own concerns and seek a mutually beneficial solution. If the conflict persists, I'm willing to involve a supervisor or mediator to find a resolution that prioritizes patient care and team harmony.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role-play. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Jordan Shell, one of the nurses here in the Community Health Center. May I have your name, for the records, please?
My name is Mihiraa.
Mihiraa, what brings you here today?
Hi, Jordan. Thank you for seeing me. It's about my child, Mario's hand. He's been having little bumps on it for a few weeks now. Today, my husband said it is warts. I am worried about it.
I see. Don't worry, I will brief you about warts first. They're actually quite common, especially in children. Warts are caused by a virus called HPV, and it's pretty contagious.
Oh, that's not good.
It can spread through touch, so it's common for kids to pick it up at school or playgrounds. It can also live on surfaces for a while, so things like towels or shared toys can be culprits too.
I see.
Well, Mihiraa, could you tell me a bit more about his symptoms?
I noticed them about 2 months ago. They started as small, rough patches, and now they've grown a little bigger. They seem a bit rough to the touch.
That's helpful to know. Mihiraa, how many have you noticed?
Well, he mentioned feeling a little bump a few weeks ago, and now there are maybe 3 or 4. They don't seem to bother him much, but I wanted to get it cured.
Well, Mihiraa, the good news is that most warts go away on their own after a while, as his immune system fights off the virus. But if they're bothering him or causing discomfort, there are a few treatment options we can try.
That's a relief. What are the options?
We have some over-the-counter creams and patches that contain salicylic acid. This helps to gradually peel away the wart layer by layer. There are also freezing sprays that can kill the wart tissue, but these can be a bit painful. These methods are generally well tolerated and often successful. But remember, picking or scratching can spread the virus and make things worse.
Okay, I got it. What about something like a surgical intervention? I think that can be effective.
Mihiraa, surgical intervention can be effective, but it's usually a last resort, because it's more expensive and can leave scars. We explore it only when other treatments haven't been successful. We usually like to try the less invasive options first and see if they work.
I understand. Thank you so much, Nurse Shell. This has been really helpful. I feel much better knowing the options.
You're welcome, Mihiraa. Just remember, patience is key with warts. They can take a while to go away, but with the right approach, they will eventually disappear. Before we wrap up, Mihiraa, let's recap what we've discussed about Mario's hand bumps. Warts are fairly common in children and are caused by a contagious virus. We talked about how they spread through touch or contact with contaminated surfaces, and how Mario's symptoms align with typical wart presentation. The good news is, most warts resolve on their own, as the immune system tackles the virus. However, if they become bothersome or uncomfortable, we have treatment options like over-the-counter creams or freezing sprays. Remember, patience is key, and picking or scratching can worsen things. While surgical intervention exists, it's generally a last resort, due to cost and potential scarring. We'll always explore less invasive solutions first, and see if they work for Mario. I hope this comprehensive overview puts your mind at ease, Mihiraa. Please don't hesitate to ask if you have any further questions or concerns.
Thank you again. I will. That is the end of your OET-speaking role-play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.